PTCB, PTCE Practice. Stay with me. I will keep this easy, short, and you will learn fast, so let's begin. You and me, we will go step by step, practice each idea, and we will improve together. If you want full practice questions with explanations, you can check the Udemy practice test link in the description. I also have an SD visual practice test that helps make learning visual. Try it, and tell me how I can improve in the comments, and don't forget to subscribe. Section 1 Medications Domain. In this section, we start with the medications domain of the PTCE exam, which has many questions you will see on test day. This part covers the basics of medicines, how they work, what they do, and how you keep them safe. In the real PTCE, about 1/3 of the questions are from this topic, so you must know it well. I will explain things so you can remember them easily. What is a generic name and a brand name? A generic name is the official medical name of a drug, like the real name. A brand name is a name made by the company that sells the medicine. For example, acetaminophen is the generic name, and Tylenol is the brand name people know. You will see both names on prescriptions, so you must remember both. Why do we learn drug classifications? Drugs are grouped by what body system they help or what they treat. For example, some drugs lower blood pressure, some help with pain, and some treat infections. Learning groups helps you know what drugs do without memorizing every single name. If you know the group, you can guess what a new drug might do. Common side effects and allergies. Every medicine can cause side effects, like nausea or rash. A side effect does not always mean the drug is bad, but you must know them so you can protect patients. An allergy is different. It can be dangerous. So if someone is allergic, you must stop giving that medicine. Always ask patients if they have allergies before giving drugs. Routes of administration. Drugs can enter the body in many ways. Some go by mouth, some are injected into the muscle, and some go on the skin. Each route works differently, so you must know them. For example, a drug through the vein works faster than one swallowed. This helps you choose the right method for each patient. Proper storage of medications. Medicines must be stored right, or they lose power. Some need cold temperatures, some must stay dry and away from light. If you mix this up, the medicine might not work when the patient needs it. Good storage keeps the drug strong and safe. Special handling and administration. Some drugs need extra care, like vaccines or strong pain medicines. Because these can be sensitive to heat or shaking, you must follow storage rules. You must know how to read a label and follow instructions every time. Therapeutic duplication and interactions. Therapeutic duplication happens when two drugs do the same thing. This can cause overdose effects or harm. Drug interactions happen when two drugs change each other's effect. This can make them weaker, stronger, or unsafe. Always check what drugs are already in the patient's list. Drug stability and expiration. Medicines change over time, and some can break down faster. Expiration dates tell you when a drug starts losing strength. If you use a drug past its date, it might not help the patient. Learning tips for this section. Practice remembering generic and brand pairs, practice common side effects, and keep flashcards of routes and storage rules. If you practice every day, you will remember the details on test day. And if you want more practice questions, grab the Udemy practice test and the SD visual practice set too. Now, let's do practice questions to check what you learned. 1. What is a generic name of a medicine? The official medical drug name, used in prescriptions and pharmacy records. Generic names are consistent across all brands and help you identify the drug no matter who makes it. 2. Why do we learn drug classifications before individual drug names? Groups of drugs act the same way, so you can understand new medicines by their group. If you know a drug group treats pain, you know it affects pain even if you never saw its name before. 3. What should you do if a patient says they are allergic to a medicine? Stop giving that medicine and inform the pharmacist or nurse right away. Allergies can be harmful, so you protect the patient by removing that drug from their list. 4. How does the route of administration affect a drug? It changes how fast and how well the medicine works for the patient. For example, something injected into a vein works quicker than something swallowed. 5. Why must medicines be stored the right way? Good storage keeps the drug strong and safe for patients to use. Heat, light, or moisture can make medicines less effective or unsafe. Stay with me, we are moving into Section 2, where we learn about federal requirements, the laws and rules that pharmacies must follow to keep patients safe. This is a big part of the test, so I will make it simple, clear, and easy for you to remember. Remember, if you want the full practice questions and answers pack, check the link in the description for my Udemy practice test and try SD Visual Practice 2, and let me know how I can improve in the comments, and don't forget to subscribe. In this section, we focus on federal requirements, the rules that every pharmacy must follow by law. The PTCE includes this topic because pharmacy technicians must know which laws protect patients and control medicines. Why do we learn federal requirements? Pharmacists and pharmacy techs work with controlled substances, like pain medicines, that the law watches closely. You must know how to receive, store, and handle them so you don't break any rules. You must also know what to do when a medicine is recalled or when a patient brings back a prescription. First, let's talk about controlled substances. Controlled substances have schedules from Schedule 1 to Schedule 5. Schedule 1 medicines are not allowed, and Schedule 5 medicines are less controlled. The lower the schedule number, the stricter the rules for storing and dispensing them. For example, strong pain medicines are often in Schedule 2, and they need special records. D and controlled substances. The D, Drug Enforcement Administration, sets rules for controlled drugs. When a patient brings a controlled prescription, you must check the date, doctor info, and refill limits. If a Schedule 2 prescription has refills, you must know that many times those are not allowed for that schedule, so you ask the pharmacist to check. Handling and disposal rules. You must know how to deal with hazardous and pharmaceutical waste. This includes leftover medicines, old containers, or products that are expired. These items must be disposed of the way the law says, not just thrown in the trash. FDA recall and safety. The FDA can recall a medicine if there is a safety issue, like wrong ingredients or contamination. When a recall happens, the pharmacy must pull that medicine from shelves and notify patients. This keeps patients safe and makes sure no one gets a bad batch. Labeling and documentation. Federal rules also tell you how labels must look. Labels need clear drug names, directions, doctor info, and safety warnings. If anything on a label is wrong, it can harm a patient, so checking labels is very important. Why this matters on the test. Questions on federal requirements often ask you, What is the correct schedule for a drug? How to handle a controlled substance prescription. What to do with a recalled medicine. How to label a drug so it is correct and safe. Study these rules well, because they are rules you cannot guess, you must know them. Now we will check what you learned with practice questions and answers, with clear explanations to help you understand. 1. What is a controlled substance schedule? A system that groups drugs by how strictly they are regulated by law. Schedule 1 drugs are the most restricted, and Schedule 5 drugs have fewer legal limits, so you know how to handle each drug type. 2. What must you check before filling a controlled substance prescription? The date, doctor info, patient info, and refill limits. Controlled substances have rules on refills and require correct info to protect patients and follow the law. 3. If the FDA recalls a drug for safety, what should you do? Remove the drug from inventory and notify patients who may have it. Recalls protect patients from harm, so you must follow recall instructions right away. 4. How should hazardous or expired medicine be disposed? According to law, in special containers, not just thrown away. Controlled and hazardous waste can harm people and the environment if not handled by rules. 5. What must be on a correct medicine label? Drug name, directions, doctor info, warnings, and date. Clear labels help patients take medicines safely and help pharmacies avoid mistakes. If you want the full practice pack with more questions, deeper explanations, and timed tests, check my Udemy practice test link in the description. Section 3 Patient Safety and Quality Assurance. In this section, we focus on patient safety and quality steps that protect patients every day. I will show simple checks, clear steps, and habits to stop mistakes before they start. You will learn how to catch errors early, how to report them, and how to fix problems. We keep language short, and we use examples so the ideas stay easy to remember. Medication errors can happen when labels are wrong, doses are wrong, or instructions are unclear. The best defense is simple habit: slow down, read the label twice, and ask questions when unsure. If you see a possible error, stop, tell the pharmacist, and write a quick note for records. Use checklists for tasks like filling, counting, and labeling to avoid missing steps by accident. Standard work means you and your team follow the same clear steps every time you fill a prescription. When everyone uses standard steps, mistakes drop, and training becomes faster and easier for new staff. We practice drills, and we simulate common errors so staff learn to catch them quickly and calmly. Record keeping is a key part of safety, because records show what happened and why it happened. Signatures, dates, and notes help trace issues back to the source and help fix the problem. If a returned medicine looks wrong, keep it separate, and ask the pharmacist how to proceed next. Never reuse a medicine from a returned bottle unless a pharmacist says it is safe to do so. Good labeling reduces mistakes, so write clear directions, and avoid abbreviations that cause confusion in care. Use patient-friendly words, and show how to take the dose with simple examples and plain phrases. If a patient seems unsure, teach them by showing a pill bottle, and explain the steps slowly. Quality assurance checks include random counts, double checks, and supervisor reviews to catch subtle mistakes. We run audits like sample checks of filled prescriptions, to watch for trends or repeating errors over time. When an error happens, We use root cause steps, not blame, to find how it started and fix systems. Write a clear incident report and describe facts, not feelings, so the team can learn from it honestly. Patient privacy is also part of quality, so keep patient data private and follow the rules for protected information. Do not share patient details on social apps, and always check with the pharmacist before discussing cases outside work. If you are unsure about a rule, ask the pharmacist and write your question so you can learn properly. Technology like barcode scanning helps check correct drug, dose, and patient match at the right time. Scan each label and match the barcode before you pack a prescription to ensure correct delivery every time. If the scanner shows an alert, stop, read the message, and tell the pharmacist for the next step. We practice using technology, and we review alerts often to keep our scanning skills sharp and confident. Communication matters a lot, so speak clearly with the pharmacist and say patient names slowly for accuracy. Use closed-loop communication by repeating instructions back, which confirms the message and reduces mistakes greatly. If you hand off a task, tell who, what, and when, so the next person knows exactly what to do. Education helps prevent errors, so we learn new drug facts and practice safe counting and labeling every week. Short, regular study sessions beat long, rare cramming because memory builds with steady practice over weeks. Use flashcards and make simple charts of errors you saw to track what you need to improve next. Ask for feedback after shifts and take small notes so you can remember tips for next time at work. Measure medication errors by type, like wrong dose, wrong drug, wrong patient, and track each case. Collect simple counts weekly and chart trends so the team can spot rising problems early without blame. Set small targets like 5% fewer errors and celebrate when the team reaches that simple goal. Use human factor ideas like clear lighting, good labels, and calm workspace layout to prevent slips and mistakes. When adopting new software, train a small group first and get feedback before rolling out to the whole pharmacy. Encourage staff to speak up if they feel rushed and give them permission to stop a process safely. Use color codes for high-risk drugs and store them apart to reduce mistaken grabs. Rotate stock using first-in, first-out rules so older medicines are used before newer ones and waste falls. Label storage areas clearly and keep temperature logs for cold medications to prove they stayed within safe ranges. Practice teamwork and plan how to cover tasks when busy, so safety stays strong during high work periods. Reporting errors helps everyone learn, so report near misses too, not just actual harm events in the pharmacy. Near misses show weak spots early, they give chance to change processes and avoid future events. Follow the pharmacy form for incident reporting, write facts, and include steps taken to protect the patient immediately. After reporting, we review the case as a team and update steps to prevent repeat errors. Remember to always follow state and federal rules and check with pharmacists when a rule seems unclear or new. If a patient asks about side effects, give simple answers and tell him to call the pharmacist for more details. We use plain language and we avoid medical slang to make sure patients really understand how to take medicines. Quality improvement is ongoing, so we collect small data, watch trends, and change one thing at a time for safety. Small changes like clearer labels or a new checklist can reduce many errors if used consistently by the team. Teach new staff with real examples and show how to fix common mistakes, then watch them perform the task slowly. We measure success by fewer errors, and by feedback from patients and staff about clearer, safer work each day. Now, we test your learning with 5 practice questions that check key safety ideas from this section. 1. What is the best first step if you notice a wrong label on a filled prescription? Stop processing it, tell the pharmacist immediately, and place the prescription aside for review. This stops harm, and lets the pharmacist check label, dose, and correct the mistake quickly. 2. Why is barcode scanning important when you dispense a prescription for patient safety? It confirms the right drug, right dose, and right patient match before leaving the pharmacy. Scanning reduces human error and alerts you to mismatches for quick correction before harm. 3. What should you include in an incident report after a medication error occurs at work? Include who, what, when, where, and clear facts about the error and immediate actions. Facts help the team find causes and change steps to lower risk for future patients. 4. How do near-miss reports help the pharmacy improve patient safety over time? They show weak spots early, allowing simple fixes before a real harm event happens. Tracking near misses reveals patterns and supports small changes that prevent future, more serious errors. 5. What is closed-loop communication, and how does it reduce mistakes during task handoffs? It means repeating back instructions, so the sender confirms the message was heard correctly and fully. Repeating information prevents misunderstandings and ensures the next person knows exact steps to complete tasks. Section 4, Order Entry and Processing, teaches how prescriptions move from prescriber to patient hands. I will show step by step how to enter orders and prevent common mistakes. We keep language simple, use short sentences, and practice each task slowly. Short drills, daily review, and careful checks help build lasting skills for work. First, check the prescription carefully, read prescriber name, date, and patient details. If any info is missing, stop, call the prescriber, and confirm before entry. Never guess unclear directions, always ask, because guessing can cause harm to patients. Enter the drug name, strength, dose, route, and refill info exactly as written. Use system lookup tools to match generic and brand names, and avoid errors. Do not use dangerous abbreviations, write full words, and check for common confusions. If multiple strengths exist, verify the strength with prescriber or pharmacist before filling. Use clinical decision support alerts in the system, and read each alert carefully. Drug utilization review checks for allergies, interactions, and therapeutic duplication automatically in many systems. If an interaction appears, pause, review severity, and notify the pharmacist immediately for decision. Therapeutic duplication needs careful review, because 2 similar drugs can increase side effect risks. Document any pharmacist interventions clearly in the patient record for future reference. When entering controlled substances, check prescription dates, D numbers, and refill limits carefully. Schedule 2 prescriptions often require special forms and may have no refill permissions generally. If a refill seems invalid, stop processing, call the prescriber, and document the call immediately. Transfers of prescriptions between pharmacies must follow state rules, and verify records before transferring. Insurance billing can change what the patient pays at the counter during pickup times. Enter insurance info accurately, including plan number, group number, and patient ID details. If a claim rejects, read the rejection reason, then correct or resubmit with pharmacist help. Some patients need prior authorization, so request PA forms early to avoid delays at pickup. Create labels with clear directions, avoid abbreviations, and add auxiliary warnings when needed. Pack medicines securely, include patient leaflets, and double-check the drug against the order. The final check should include barcode scanning, label review, and pharmacist verification before release. If any discrepancy appears, hold the medication, notify the pharmacist, and resolve with calm actions. At pickup, ask the patient to confirm name and date of birth before handing the medication. Provide short counseling, explain dose, times, and possible side effects in plain language. If the patient seems unsure, offer to call the pharmacist for more detailed help after pickup. Document counseling in records if pharmacy policy requires, and note any special instructions given. Returned prescriptions should be quarantined, checked by the pharmacist, and documented in records. If a patient brings back excess medication, follow store policy and federal guidelines before disposal. For billing refunds, process claims correctly and inform the patient about any changes to payments. When errors happen, write facts in an incident report, and help the team improve processes. Practice common scenarios with mock entries, session drills, and review sessions every week. I recommend the Udemy practice test for more questions and detailed explanations to practice. Also try the SD visual practice set. It helps memory by using clear visual cues often. Leave suggestions in the comment section, tell me what topics you want next, and subscribe. Electronic prescriptions arrive faster, but you must still verify prescriber details before filing into the system. Check e-prescription signatures and provider NPI numbers when the system does not auto-validate properly. For controlled e-prescriptions, ensure the electronic signature meets D rules before accepting the order. Partial fills for controlled drugs require clear documentation, and patient consent must be recorded each time. Use note fields in the record to write short, clear reasons for overrides or special instructions given. Time stamps and staff initials help trace who entered or changed orders during busy shifts. When handling multi-drug orders, separate packing by patient name to avoid mixing multiple patients' supplies. For mail orders, confirm address accuracy, package securely, and add tracking information before dispatch. Cold chain shipments need temperature control, and document temperatures during transport for safety records. Handle high-cost medicines carefully, require pharmacist sign-off, and verify insurance coverage before dispensing. Use clear handwriting when prescribers write by hand, and call prescriber if any word is unclear. Avoid common look-alike drug mistakes by grouping different medicines separately on shelves and in bins. When a new staff member starts, pair them with a trainer, and supervise entries for several shifts. Practice timed drills to speed data entry without losing accuracy, and review mistakes after each session. Keep a short cheat sheet for common insurance codes, but do not share patient private data on it. If a patient cannot pay, explain options gently, and offer to call insurance or pharmacist for help. Record patient refusals or special requests in notes, so future staff know the patient's preferences clearly. When dealing with multiple phone calls, use a triage system to handle urgent orders first, calmly. Always close patient windows on the computer before stepping away, to protect privacy and avoid mistakes. Track metrics like average entry time, claim rejection rates, and refill accuracy to measure improvement. Celebrate small wins, like fewer rejections or faster fills, to keep team morale high and focused. Keep learning short and steady, watch examples, practice entries, and ask for feedback after shifts weekly. Learn common rejection codes, and make a quick guide for common fixes and resubmits at work. When performing final checks, read the label aloud to yourself, matching patient name and drug details. Always keep calm, speak kindly, and treat each patient as a person, not just a case number. Finally, remember to check for updates in pharmacy software, and attend brief trainings when available. Small, steady practice builds strong habits, and we can all reduce errors by working together daily. Get the full course in the description, grab the Udemy practice test, and try the SD visual set. Now check your knowledge with 5 practice questions. 1. What should you do if a prescription has missing patient information? Stop entry, call the prescriber, and confirm missing patient details before continuing. Confirming details prevents wrong deliveries and protects patient safety. Always document the call. 2. How do you handle an insurance claim rejection at the counter? Read the rejection reason, correct the entry or resubmit with pharmacist help right away. Fixing errors quickly may lower patient wait time and improves billing accuracy for future refills. 3. What is the final check before releasing a filled medication to a patient? Scan barcode, verify label details, and have pharmacist approve the release before handing it over. This final step catches mismatches and prevents wrong patient or wrong drug errors before pickup. 4. How should you pack mail-order medicines needing cold storage? Use temperature control shipping, include temperature logs, and seal package with secure tracking details. Cold chain keeps drug potency, and documentation proves safe handling during transport for patient safety. 5. When a refill looks invalid for a controlled drug, what is your first action? Stop processing, contact the prescriber for clarification, and document the contact in records immediately. Calling prevents illegal dispensing, keeps records clear, and protects the pharmacy and patient from harm. Section 5, Inventory Management and Compounding Basics. We will learn clear, practical steps for daily pharmacy work. I will guide you through stock checks, ordering, compounding safety, and simple record methods today. Good inventory keeps medicines available, reduces waste, and protects our patients from shortages. We will use simple counts, rotation rules, and clear logs to manage stock every day. Start with a daily shelf check, look for low items, and mark reorder needs clearly. I recommend we set par levels for each product, based on usage and lead time. Par levels tell us when to order, and prevent both shortage and overstocking easily. When ordering, check supplier lead times, order quantities, and confirm shipment dates with vendors. Rotate stock using first in, first out rules so older medicines are used before newer ones. Mark dates clearly on each box, and train the team to follow the same rotation steps. When items expire, remove them immediately, and follow disposal rules without delay. Controlled substance inventory needs special attention, follow strict counts and secure storage rules always. We must log all receipts, transfers, and wastage clearly with signatures and correct dates. Do the required inventory audits and report discrepancies to the pharmacist for quick action. If a count mismatch appears, recount carefully, document findings, and involve the pharmacist immediately. Compounding requires cleanliness, correct measurements, and following written formulas every single time. We must wear proper protective gear and work in a clean, designated compounding area always. Follow measurements exactly, use calibrated tools, and double-check calculations with another person. Label compounded items with full details, date made, beyond use date, and staff initials clearly. If sterile compounding is needed, follow USP standards and pharmacy protocol every single step. Build good relationships with suppliers, so you can confirm orders and fix shipment problems quickly. Compare prices and quality, and choose reliable vendors who meet your safety and delivery needs. Keep backup suppliers for critical medicines so shortages do not stop patient care during delays. Use inventory software to track stock, counts, and reorder points with reliable accuracy every day. Train staff to log transactions immediately and reconcile records at the end of each shift. Run periodic physical counts to match software records and fix any small mismatches fast. When a recall happens, pull the affected lots, quarantine him, and notify the pharmacist immediately. Record lot numbers and actions taken, and follow supplier or FDA instructions for returns or disposal. For customer returns, quarantine items, check condition, and get pharmacist approval before restocking. Use proper containers for biohazard, sharps, and hazardous waste to protect staff and environment. Follow local and federal rules for disposal, and document waste pickups and destruction steps clearly. Pharmacy math matters, so practice dose calculations, dilutions, and measurement conversions often with care. Always show your math, and have another person verify calculations for important preparations. Train new staff on inventory steps, compounding basics, and safe handling practices with hands-on practice. Keep clear SOPs accessible, and update them when processes change or new products arrive in stock. Document training dates, trainers, and competencies so we can show compliance during audits easily. Practice simple counting drills, do mock recalls, and simulate compounding steps during slow hours weekly. Use the Udemy Practice Test and SD Visual Practice set for extra examples and timed practice sessions. I suggest you study short sessions, repeat tasks often, and review errors to build lasting skill. Before you restock shelves, do a quick visual check and confirm lot numbers match records for safety. Keep clear labels and separate look-alike or sound-alike drugs to prevent wrong grabs by staff. If you see damage on packaging, hold the product and ask the pharmacist before placing it back. Always follow federal and state rules for controlled drugs, and keep audits ready for review at all times. We practiced inventory and compounding basics, so you now have clear, practical steps to follow daily. Label storage areas with clear signs, and use color codes to highlight high-risk drug bins. Make routine checks for temperature-sensitive meds, and keep a daily log for cold chain items. When shortages occur, notify prescribers early and suggest safe alternatives, with pharmacist approval. Celebrate small inventory wins, like fewer expired items, and share tips at short team huddles weekly. Now, test your learning with 5 practice questions from this section. 1. What does first in, first out rotation mean, and why do we use it daily? It means older stock goes out first, and we prevent waste and shortages. Using FIFO protects patients, keeps potency, and lowers expired product waste in pharmacy. 2. How often should controlled substance inventory be audited, and who signs counts? Audit controlled substances regularly, at least monthly, and the pharmacist signs each count. Frequent audits reduce diversion risk, and signatures provide accountability for every inventory change. 3. What are key steps before compounding a non-sterile medication in the pharmacy? Clean workspace, check formula, measure accurately, wear gloves, and verify calculations with another person. These steps reduce contamination and measurement errors, protecting patient safety and dose accuracy. 4. How do you handle a recalled lot that is already in store inventory right now? Quarantine the batch, record lot numbers, notify pharmacist, and follow supplier recall return instructions immediately. Fast action prevents patient exposure, ensures traceability, and helps the pharmacy meet legal requirements. 5. Why do we use inventory software and perform physical counts to match records each week? Software tracks levels, but physical counts catch mistakes, ensuring accurate stock and patient safety. Matching systems and physical checks prevent shortages, overstocking, and errors in patient medication supply. Section 6 covers calculations and measurements you will use daily as a pharmacy technician. Stay with me, practice these problems aloud, and your speed will improve quickly. We will study conversions, doses, IV rates, percentages, and ratio methods step by step. Start with metric units, because most drugs use milligrams, milliliters, and grams for measures. Know basic prefixes like kilo, centi, milli, micro. They change values by powers of 10. For example, 1 milligram equals 1,000th of a gram, so you convert carefully each time. Use dimensional analysis to cancel units, set up fractions so units cross out step by step. When you calculate doses, always double-check patient weight, drug strength, and dose order before proceeding. Many orders use milligrams per kilogram, so multiply the patient's weight by the ordered milligram per kilogram. Amount. Example, if patient weighs 70 kilograms, an order reads 2 milligrams per kilogram, multiply for total milligrams. Rounding rules matter, so round to the nearest practical amount, follow facility policies for rounding decimals. IV flow rates use drops per minute, or milliliter per hour. Learn both methods well for practice. For drops per minute, use formula. Volume times drop factor divided by time in minutes, memorize carefully. For milliliter per hour, divide total ml by total hours, then set pump to the calculated hourly rate precisely. Percent strength questions ask for amount of drug in solution. Write percent as a fraction to solve clearly. Example, a 2% solution contains 2 grams per 100 milliliters. Convert units before calculating dose. Use ratio and proportion for many problems. Set x over given equals desired over known and solve for x. Calculating concentrations requires clear units, percent, MEQ, and units vary by drug and practice setting. Be careful with insulin and heparin. They use units or ml per unit. Check orders and vial concentrations exactly. Aliquoting and milliliter measures need precise lab tools. Use syringes for liquid, scales for powders, follow formulas. Compounding math includes yield and loss. Calculate final amount needed. then adjust for expected loss during preparation. Practice drug calculations daily. Short sessions with timed drills build speed and improve accuracy over weeks. Use dimensional analysis. Write units, cancel them. This method prevents many common calculation mistakes in practice. When using calculators, always estimate the answer first. Compare results to the estimate to find errors quickly. Double-checking calculations with another person reduces risk. Teach peers to review math and show work each time. Memorize common conversion factors like 1 teaspoon equals 5 milliliters and 1 tablespoon equals 15 milliliters exactly. Avoid rounding too early. Keep extra digits while calculating. Round final answer to appropriate clinical precision only. Practice with real examples from practice tests. Use the Udemy practice test for many timed calculation problems daily. ST Visual Practice helps you see steps clearly, use visuals while solving, and teach others to explain processes. Now we test your skills with 5 practice questions that check key calculation ideas from this section. 1. A patient weighs 50 kilograms. Order reads 5 milligrams per kilogram. What is total dose? The total dose is 250 milligrams, to give at once. Multiply weight by milligram per kilogram. 50 times 5 equals 250 milligrams total. 2. You must prepare an IV at 300 milliliters over 6 hours. What is milliliter per hour? You should set the infusion pump to deliver 50 milliliters per hour, exactly. Divide total volume by hours. 300 divided by 6 equals 50 milliliters per hour. 3. A solution labeled 2%. How many grams are in 100 milliliters of this solution? There are 2 grams in 100 milliliters of a 2% solution. Percent means grams per 100 milliliters. 2% equals 2 grams per 100 milliliters. 4. A tablet strength is 250 milligrams. Order calls for 500 milligrams. How many tablets give? Give 2 tablets to reach 500 milligrams total. Check for tablet division policies. Divide desired dose by tablet strength. 500 divided by 250 equals 2 tablets. 5. You need final concentration 1 milligram per milliliter. You have a 100 milligram vial. What volume is required? You should add 100 milliliters of diluent to the vial to make 1 milligram per milliliter. Divide total drug by desired concentration. 100 milligrams divided by 1 milligram per milliliter equals 100 ml. If you want more practice, get the Udemy practice test link in the description now. Use ST Visual Practice to see steps, try visuals, and tell me what to improve. Leave suggestions in the comments, and please subscribe so I can make more helpful lessons.